Welcome, my dear viewer, Health Channel. Today I want to discuss very shortly acute kidney injury. Acute kidney injury is where the kidney suddenly stop working properly. It can range from minor loss of kidney function to complete renal failure. Renal failure may be acute or chronic kidney disease. Incidence of acute kidney injury is 2 to 3 cases per 1,000 persons and 7% of hospitalized patients. About two-thirds of the patients in intensive care unit develop acute kidney injury and too often is a part multi-organ failure. Global prevalence of chronic kidney disease for men 1 in 5 is 65 up and 1 in 4 in women. The kidney failure may be acute or chronic. Acute kidney failure due to pre-renal, renal, post-renal. Pre-renal heart failure, sepsis, blood loss, dehydration, vascular occlusion. Renal glomerulonephritis, small vessel vasculitis, acute tubular necrosis, drug, toxin, prolonged hypotension, interstitial nephritis, drug, toxin, inflammation, disease, infection, post-renal urinary calculus, retroperitoneal fibrosis, benign prostate, enlarged prostate, cervical cancer, urethral stricture, mitral stenosis, acute kidney injury by direct viral infection, same coronavirus. For coronaviral infection, collapsing the glomerulopathy, endothelial damage, coagulopathy, complement activation, inflammation. Indirect effect of fluid management, mechanical ventilation, nephrotoxin, and organ cross-link. Fever, sepsis, diarrhea, hypovolemia, acute tubular injury. So hypovolemia, traumatic injury or shock, severe illness, and intrinsic nephrotoxicity, contrast, die. Rhabdomyolysis, hypoxia, ischemia, vascular damage, prolonged hypertension, inflammation, sepsis, infection, post-renal obstructive cause and malignancy. The tissue damage, hypoxia, ischemia, nephrotoxin, endothelial activation, inflammation. Symptoms, the feeling sick, diarrhea, dehydration, confusion, drowsiness. 15.3% pregnant women preeclampsia after acute kidney injury, maternal death, ICU admission, and stillbirth. Blood loss due to severe blood loss in during delivery also produce acute kidney failure, acute kidney shutdown. Laboratory finding urine osmolarity, perirenal 500 more than, intrinsic 350, post-renal osmolarity urine less than 350, and fraction of sodium pre-renal less than 1%, intrinsic more than 2%, post-renal 40%. Routine kidney profile test, blood urea, nitrogen, creatinine, and total protein, albumin, globulin, albumin ratio, serum electrolyte, blood gas, blood pH, bicarbonate, plasma, urine osmolarity, creatinine clearance, and routine urine examination. Glomerular manifestation, the disease due to deposition of monoclonal immunoglobulin leading to glomerulopathy, proteinuria, amyloidosis, monoclonal immunoglobulin deposition disease, proliferative glomerulonephritis, monoclonal IgG deposition, monoclonal cryoglobulinemia, membranoproliferative glomerulonephritis, C3 glomerulopathy, fibrillary glomerulonephritis, immunotactoid glomerulopathy, and overproduction of immunoglobulin. Proximal tubulopathy, endocytosis leading to acute tubular injury, fibrosis leading to Fanconi syndrome with acute kidney injury, cast nephropathy, insoluble cast that obstruct the tubular lumen, elicit the local inflammation. Endothelial damage, podocyte localization, proximal tubular localization, mitochondrial dysfunction, acute tubular necrosis. Hypovolemia, cytokine storm due to coronavirus also produce the acute kidney injury, and pneumonia by coronavirus, acute respiratory stress syndrome, mechanical ventilation produce the kidney injury. Hypercoagulability, endothelial damage, microthrombi, rhabdomyolysis, microembolism, kidney infarction, and myocardial dysfunction also produce acute kidney injury. And chronic kidney disease or chronic renal failure due to diabetes, high blood pressure, heart problem, obesity, family history of obesity or diabetes or renal failure, tobacco use, and age above 60. Acute renal failure, blood urea nitrogen serum creatinine level, CBC peripheral smear, serology urine analysis, urine electrolyte, ultrasound of the kidney, and serology ANA, NCA, anti-DNA, hepatitis B virus, hepatitis C virus, anti-glomerular basement membrane, cryoglobulin, CK urinary myoglobulin. Chronic kidney disease gradually lost the function over a long period of time due to sepsis, heart failure, liver failure, diabetes, enlarged prostate, stone, and urinary tract infection. GFR, glomerular filtration rate, normal range 90 to 120 ml per minute per 1.73 meter square. Older people decrease with age. Human kidney has cortex and medulla and tube the glomerulus with proximal convertible descending limb or lobe ascending limb, lobe distal convertible, and renin angiotensin aldosterone system. Liver produces the angiotensinogen. It produces on angiotensin 1 through renin. Angiotensin converting enzyme through the lungs and kidney endothelium produce angiotensin 2. Angiotensin 2 stimulates simple activity, tubular reabsorption of sodium, potassium, excretion, water retention, and aldosterone increase the water retention. And ADAs, which secreted posterior pituitary gland, produce water retention, water salt retention. GFR 60 to 120 normal. Below 62 the kidney disease, and below 15 is renal failure. End list is renal failure below 15. The glomerulus for filtration and convoluted tubule, proximal convertible reabsorption secretion, descending limb, here solute concentration, and collecting duct, here for reabsorption. The ECG, we check the ECG. The Q wave is U wave, hypokalemia, T wave hyperkalemia, QT prolongation, hypocalcemia, ST segment shortening, hypercalcemia. The acidosis, alkalosis compensation by renal and respiratory, homeostasis of sodium, and kidney biopsy by detection of renal failure. How to prevent the kidney disease? To avoid the all nephrotoxic medication and pharmacological medication for hyperphosphatemia, hypocalcemia, anti-seizure medication, antihypertensive, and erythropoietin, low sodium, low potassium diet, and acute stage the renal failure need dialysis. Kidney transplant, and the last of all, the kidney transplantation. Every patient produce the kidney patient care, peritoneal dialysis, hemodialysis,